Autism Spectrum Disorder, ASD, is a condition that affects approximately 2% of boys and 0.5% of girls. In this discussion, we will delve into the symptoms and signs commonly associated with girls diagnosed with autism, as well as the specific forms of autism prevalent among girls. Starting with classical autism, this form is characterized by three primary signs. The foremost sign is social challenges, where girls often exhibit a lack of interest in social interactions and face difficulties connecting with their peers. These children typically prefer solitude and are more comfortable being alone. The second predominant sign revolves around communication issues, which can manifest as a delay in language development, absence of spoken language, or even speaking in a formal and robotic tone. Lastly, repetitive behavior is another key symptom. Examples include hand flapping when a child finds something captivating, sticking to specific routines or interests, and experiencing distress if these routines are disrupted. When it comes to intellectual capabilities, there's a spectrum. Some children may have intellectual disabilities, while others possess average or above average intellect. However, it's essential to note that classical autism isn't the most prevalent form among girls. Only about 27% of girls with autism exhibit this form. The prognosis for classical autism is mostly positive, with 70% of these children eventually living a fully or partially independent life, while 30% remain dependent on caregivers. Shifting our focus to the most common form of autism in girls, we find Asperger syndrome, which accounts for 37% of cases. The defining features of Asperger syndrome include normal to above-average intellect and typically no language delays. In fact, their language skills and vocabulary are often on par with their peers, although minor language delays can sometimes occur. Children with Asperger's often have a deep fascination with specific topics. For instance, a 10-year-old girl might possess extensive knowledge about trains, delving into intricate details about mechanics, history, schedules, and more. The prognosis for Asperger syndrome is excellent, with 70% of these children leading fully independent lives and only 5% relying on caregivers. Another notable form of autism in girls is pervasive developmental disorder, which can be considered a milder version of classical autism. Children with this disorder may experience some social challenges, language delays, and repetitive behaviors, but these symptoms are not as pronounced as in classical autism. The prognosis is generally favorable, with only 10% becoming dependent on caregivers in their later years. In many cases, children diagnosed with this disorder have average or above average intelligence. Childhood disintegrative disorder is a rarer but more severe form of autism. A unique characteristic of this disorder is regression. Children initially develop normally but begin to regress around the ages of 2 or 3, forgetting previously learned skills and exhibiting autism symptoms. Unfortunately, the prognosis for this disorder is not optimistic, with most patients requiring caregiver support. Lastly, we have Rett syndrome, another severe form of autism that exclusively affects girls. This syndrome leads to slowed head growth in children, deterioration of hand skills, limited mobility, irregular breathing patterns, and other autism symptoms. The prognosis for Rett syndrome is also grim, with most patients becoming dependent on caregivers.